Joint replacement has changed dramatically in the past 10 years. For example, these surgeries used to be very large incision, rather traumatic, with a great amount of blood loss, extensive stay in the hospital, and an additional extensive stay in inpatient rehab facilities. All of that has changed for the better. I personally practice using the latest minimally invasive surgery techniques. We use very small incision. Often we cut down anywhere from 10 inches down to 3 to 4 inches. We spare the muscle planes to not affect recovery afterward. We end up gluing up the incision so no stitches or staples that need to be taken out afterward. Oftentimes, we use medications around the time of surgery to minimize blood loss, so transfusions are rarely a reality these days. We use what's called a multimodal pain approach, where you're not just given a narcotic medicine, which puts you out of commission, but rather a variety of different medicines, whether it's an anti-inflammatory, a nerve pain medicine, a variety of local nerve blocking techniques to make your stay and perioperative experience as less painful as possible. This allows you, as a patient after surgery, to get up and move as soon as an hour or two after surgery, where the therapist gets you up and walking. And some people even leave the same day. But oftentimes, the bulk of the therapy is done the next morning, and you're walking either with a cane or maybe a walker. And oftentimes, patients leave at the most a day or two after surgery. And then you go home after surgery is done. A therapist will come to you at the comfort of your home. A nurse will come visit you, and oftentimes you enjoy the comfort of your home and work with a therapist. And after that, you segue into an outpatient physical therapy program. Oftentimes you're driving in about 2 weeks, so you're independent and functioning on your own, and you go to an outpatient therapy. In around 6 weeks, you're back in the game. So recovery these days are much, much better.